Hi everyone, happy Wednesday. Hope you're all doing well and are staying safe during this very active and fast moving thunderstorm that we've got going on in the DMV. Today we're going to be talking about important wellness tests for women and just preventative healthcare for women, so tune in. We'll get started momentarily once we have Whitman-Walker in the room. And they have just joined us. Just going to get them on stage with us and we'll go ahead and get started. Hey Paul, how are you? Cool. So, during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs. Hey, Elon. Hope you're doing well. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. So my name is Jewel and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's Community Health Department. And today we're going to discuss preventative healthcare for women and wellness test. So preventive healthcare is one of the strongest healthcare intervention tools that we can use to maintain our long-term health. It's easier and more cost-effective to prevent poor health from happening than it is to treat disease and pay for long-term care that's needed after a diagnosis. So today we're going to discuss a few important tests and screenings that women and people who were assigned female at birth should consider adding to their healthcare tool belt. The Women's Preventative Services Initiative shares the following screenings and schedules for women's health. First up, we've got breast cancer screening for average risk women. So they recommend that average risk women, or people who are at average risk for getting breast or chest cancer, start getting mammography screenings no earlier than the age of 40 and no later than the age of 50. Screening for mammography should occur at least biannually or every 2 years, and as frequently as annually or every year. Screening should continue through at least age 74, and age alone should not be the basis to discontinue or stop getting screened. If you are a person who has breast cancer that runs in your family, then it's important to consider getting tested for the BRCA gene or the breast cancer gene. So this is the most common gene to mutate and cause breast cancer, and people inclusive of women, men, and all genders, or anyone who inherits this gene from a family member, are at increased risk for developing breast cancer and can also pass these genes on to their children. If breast cancer runs in your family, you can meet with a genetic counselor to discuss your risk and options. And by using information about the family history of cancers, the genetic counselor can recommend whether genetic testing for breast cancer is needed or not. And if testing is recommended, they can also help decide which breast cancer genes should be tested for. This can also inform your care and prevention plan, helping you to determine when to start getting preventative health exams like mammograms. Next, we've got screening for anxiety. The Women's Preventative Services Initiative recommends screening for anxiety in adolescent and adult women, including those who are pregnant or postpartum. Optimal screening intervals are unknown, and clinical judgment should be used to determine screening frequency, but given the high prevalence of anxiety disorders, lack of recognition in clinical practice, and multiple problems associated with untreated anxiety, clinicians should consider screening women who have not been recently screened, and probably people in general. Next, we've got screening for cervical cancer. So the Women's Preventative Services Initiative recommends a cervical cancer screening for average risk women, or people who are at average risk for cervical cancer, who are aged 21 to 65 years old. For women who are ages 21 to 29 years old, they recommend cervical cancer screenings using cervical cytology, or a pap test, if you've heard of that, every 3 years. A pap test is also known as a pap smear and is when a sample of cells from your cervix are collected and tested for abnormalities and precancerous cell growth. Co-testing, or testing at the same time with the pap test and the HPV or human papillomavirus test, is not recommended for women who are under the age of 30 years old. For women who are aged 30 to 65 years old should be screened with a pap test and a human papillomavirus test, or HPV test, every 5 years. Or if it's just the pap test by itself, it should be done every 3 years. Women who are women or people with cervixes who are at average risk should not be screened more than once every 3 years. Please note that no matter your sexuality or gender identity, if you have a cervix, which is that mini kind of donut-esque shape that sits at the top of your vaginal canal or front hole, and it sits at the bottom of your uterus. It's important that you stay up to date on cervical screenings. They can literally save your life and help you catch cervical cancer early, or other things like HPV early. Next, we've got screening and counseling for interpersonal and domestic violence. So the Women's Preventive Services Initiative recommends screening adolescents and women for interpersonal domestic violence at least annually, and when needed, providing or referring for initial intervention services. Interpersonal and domestic violence includes physical violence, sexual violence, stalking, and psychological aggression, including coercion, reproductive coercion, neglect, and the threat of violence, abuse, or both. Intervention services include but are not limited to counseling, education, harm reduction strategies, and referral to appropriate supportive services. Next, we've got screening for diabetes. I'm going to take a sip of water first. So it's recommended that women and people with a history of gestational diabetes or diabetes while you are currently pregnant, who are not currently pregnant and who have not previously been diagnosed with type 2 diabetes should be screened for diabetes. Initial testing should ideally occur within the first year postpartum and can be conducted as early as 4 to 6 weeks postpartum or after you've given birth. Women and people with a negative initial postpartum screening test result should be rescreened at least every 3 years for a minimum of 10 years after pregnancy. And for women with a positive postpartum screening test result, testing to confirm the diagnosis of diabetes is needed regardless of the initial test. Repeat testing is needed in women and people who were screened with hemoglobin A1C in the first 6 months postpartum or after giving birth, regardless of the result. So that's after pregnancy. Now, if you're currently pregnant, these are the recommendations for diabetes testing. So folks they recommend that screening pregnant women or people for gestational diabetes after 24 weeks of being pregnant, preferably between 24 and 28 weeks of being pregnant in order to prevent adverse birth outcomes. They also suggest that women with risk factors for diabetes be screened for pre-existing diabetes before 24 weeks of pregnancy, ideally at the first prenatal visit based on current clinical best practices. Finally, we've got the screening for urinary incontinence, which is just kind of your lack or control of how much you urinate. But they recommend being screened for this annually, and screening should ideally assess whether a woman or person experienced urinary incontinence, again, for lack of control of how frequently you urinate, and whether it impacts their activities and quality of life. And if you are experiencing that, you should be referred to, for further evaluation and treatment if needed. So those were a few of the higher level preventative screenings as recommended by the Women's Preventive Services Initiative, but some additional screenings and prevention services as shared by healthcare.gov for pregnant women and people, or women and people who may become pregnant include breastfeeding support and counseling from trained providers, and access to breastfeeding supplies for pregnant and nursing women, birth control, FDA approved contraceptive methods, sterilization procedures, and patient education and counseling as prescribed by a healthcare provider for women with reproductive capacity, not including abortifacient drugs. This does not apply to health plans sponsored by certain exempt religious employers. They also include folic acid supplements for women or people who may become pregnant, maternal depression screening for mothers at well baby visits, or parents at well baby visits, preeclampsia prevention and screening for pregnant people with high blood pressure, RH incompatibility screening for all pregnant women and people, and follow-up testing for women at higher risk, syphilis screening, expanded tobacco intervention and counseling for pregnant tobacco users, and urinary tract or other infection screening. Finally, a few of the other covered preventative services for women include bone density screening for all women who are age 65 or women age 64 and younger that have gone through menopause, and this can help detect diseases like osteoporosis. They also recommend chlamydia infection screening for younger women and other women at higher risk, gonorrhea screening for all women at higher risk, HIV screening and counseling for everyone ages 15 to 65 and other ages at increased risk, PrEP or pre-exposure prophylaxis, which is HIV prevention medication for HIV negative people who are at high risk for getting HIV through sex or injection drug use. Additionally, sexually transmitted infections counseling for sexually active women and people, tobacco use screening and interventions, and finally, well woman visits to get recommended services for all women and people with uteruses and cervix. So most health plans must cover these preventive services, including shots and screening tests at no cost to you. All marketplace, also known as the ACA or the Affordable Care Act, and sometimes Obamacare insurance, health plans and many other health plans must cover preventive services without charging you a copayment or co-insurance. So you should go in, not pay a thing, get your screening tests, and walk out without paying a thing. So this is true even if you haven't met your yearly deductible, which is usually the amount of funds that you've got to dish out of your own pocket before your insurance will kick in and start to cover your cost of care. So to be sure, just be sure to schedule your complimentary screenings and tests and be a champion for your own preventive health care. And if you leave here with nothing else today, let it be to schedule your tests and screenings for the following. So be sure to get tested for STIs and HIV, get screened for breast cancer and cervical cancer by way of mammograms and Pap tests or Pap smears, and get screened for diabetes as well as to monitor your sugar intake levels. Thank you all for taking some time to learn about preventative women's health care. And of course, before we go, we're living through a handful of public health emergencies and pandemics, so we have some more information for you. If you've already gotten vaccinated against COVID-19, that's awesome. You've taken a really important step to preventing yourself and your loved ones in your community from getting sick. Multiple variants have soared across the world, and it's understandable if you want to keep wearing your mask, especially when you are inside or in tight spaces or really packed spaces with people where there's barely ventilation. So just keep alert, stay alert. As we all know, vaccines do not prevent new cases of COVID-19, but they do help you not get super sick with COVID-19. They help you not end up in the hospital with COVID-19, and they help you not die due to COVID-19. If you have not been vaccinated and you want to get a vaccine appointment, Whitman-Walker Health has COVID-19 vaccine available. Give them a call at 202-207-2480 to make an appointment. And if we're just out of region for you or just not an accessible location for you and you're a DC resident, you can call 1-855-363-0333 or visit vaccinate.dc.gov. If you're a Maryland resident, you can call 1-855-634-6829 or visit covidlink.maryland.gov. And if you're a Virginia resident, you can call 1-877-829-4682 or visit vaccinate.virginia.gov. If you have not been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines around mask wearing, social distancing, and the like, and just discuss COVID precautionary measures with people who are around you. And be mindful of masks and keep your distance, but especially when you do not know whether a person has been vaccinated or not. And then monkeypox, because that's our other public health emergency right now. According to the CDC, there are more than 9,492 cases of monkeypox currently documented in the U.S. And according to the CDC, 318 of those reported cases are in the District of Columbia, and 219 of them are in Maryland. And according to Virginia's Health Department website, 175 cases are currently in Virginia. So Virginia is working with local care providers to contact, trace, and identify those most in need of the monkeypox vaccine or the mpox vaccine. And varying counties in Maryland are allowing residents to pre-register for monkeypox vaccination. Please visit your state's local health department for more information about how to register for a vaccine appointment and how to get vaccinated against mpox or monkeypox. In DC, you can pre-register for an appointment for monkeypox or mpox vaccination at dchealth.dc.gov/page/monkeypox. Again, that's dchealth.dc.gov/page/monkeypox. And beginning last Friday, August 5th, they opened up some walk-up vaccine locations, and they're available from noon until 8 p.m. on Fridays, or while supplies last at the DC Health monkeypox vaccine locations. These are located at 3640 Martin Luther King Jr. Southeast in Ward 8, 7530 Georgia Avenue Northwest in Ward 4, and 1900 I Street Northwest in Ward 2. Walk-up vaccinations are provided on a first-come, first-served basis, and they're available to eligible residents who have not already received a first dose of the monkeypox vaccine. You are currently eligible to be vaccinated in DC if you are a District of Columbia resident, 18 years of age or older, and you identify as gay, bisexual, or another man who is 18 and older who has sex with men and have had multiple or anonymous sexual partners in the last 14 days. If you are a transgender woman or non-binary person who is assigned male at birth who has sex with men, or if you're a sex worker of any sex or a staff of any sex establishment where sexual activity occurs, so think bathhouses, saunas, and sex clubs. And when you do go for your vaccine appointment, you do need to prove your DC residency, so they'll accept an identification card with a DC address, a utility bill, or other mail with your name on it, and a DC address or a current DC lease or mortgage with your name on it. Be safe out there. Lots of things going on. Please follow Whitman-Walker at Whitman-Walker on Facebook, Twitter, and Instagram, and follow our family accounts at RealTalkDC_ and at NoFilterDC, and keep up with our latest resources and information at whitman-walker.org. Have a great rest of your day.